come on. So I'll start off, and then I think, Wendy, are you the only other person from the central office? Okay, so I'm Laura Rushnig, and I'm a health services researcher with the Department of Healthcare Reform. And Ina will not be able to attend today, so I will probably be doing most of the facilitating.
Do you want me to go and then hand it to someone else?
How about you go, Wendy, and then I'll just read off people as they appear on my participant list. That's probably the most straightforward way to do this.
Wendy Drafton from the Healthcare Reform team at AHS.
So the lucky first person on my participant list is Sherry Barnard. So why don't you just give us your organization and your role?
Hi, everyone. My name is Sherry Barnard. I work at Vermont Tech right now, which is soon to be Vermont State University, and my role currently is a couple of things. The interim associate dean for the nursing program, and then I'm also the nursing coordinator of school programs. And I'm sure there'll be more changes as we move into the transition.
Great, thank you. And then Devin.
Hi, everyone. Devin Green from the Vermont Association of Hospitals and Health Systems.
Betsy.
Hi, everyone. Betsy Hassan. I'm the Director of Nursing Education at University of Vermont Medical Center.
Helen.
I'm Helen Laban. I'm the Executive Director of the Vermont Healthcare Association. I don't know if Laura is going to be able to, thanks, Devin. I don't know if Laura is going to be able to join us. We are transitioning roles in different committees. This is my first week. Don't ask me detailed questions.
Well, bear that in mind. Jessa?
Hi, Jessa Barnard. I'm the Executive Director of the Vermont Medical Society. We represent physicians and physician assistants.
Thanks. And then Jill?
Hi, Jill Olson, Executive Director of the VNAs of Vermont, representing home health and hospice.
Mary Kate?
Hi, Mary Kate Molman, Vermont Director of Public Policy for Bi-State Primary Care Association.
Maureen?
Hi, Maureen Hebert. I work for UVM Professional and Continuing Education and used to work with Sherry. Hey, Sherry.
Abby?
Hi, everyone. My name is Abby Rim. I work with the Vermont State Workforce Development Board, so I work in the governor's office and with the Vermont Department of Labor.
And then Stephanie?
Hi, I'm Stephanie Pagliuca, and I'm the Senior Director of Workforce Development and Recruitment at Bi-State. And Helen, your office looks very similar to what it looked like when you worked with Bi-State. So just saying.
I have plans for redecorating, though. I want everyone to know, big plans.
Thank you.
And then Cheryl.
Hi, everyone. Cheryl Wilcox. I work for the Department of Mental Health. I'm the Interagency Planning Director.
Great. Is there anyone else who has joined since? I think we're good. Okay.
Oh,
Hi. Oh, sorry. I didn't hear you say my name, but I was
I must have. I'm sorry.
That's okay. Mary Ann Sheehan. I work for the Vermont Business Roundtable.
Great, thank you. And sorry about that. Okay, so on our agenda for today, we thought that we could go over some of the recommendations that were included in the Healthcare Workforce Development Strategic Plan last fall. And we've done some status updates, and we thought we could go over those status updates and then take any additional comments that people have. And I'm going to share my screen shortly. The reason I normally would have sent this out before, so we don't have to rely on screen sharing, but I figured that we're going to send a finalized version of this out after this meeting. And so to kind of just prevent there from being like tons of different versions around, I'll just send out the finalized version after. So I am going to share my screen, and then you can all let me know if you want. see an Excel worksheet?
Yes.
Okay, so just to give a little bit of an orientation to how we've set this up, the recommendation from the Healthcare Workforce Development Plan is here in column A. In the plan itself, it gave kind of an agency that was responsible, or a set of agencies or parties where they were the parties that action was required by. I've put them here. We can update that if it seems like maybe since that report was done, it makes sense to change that. And then there's a status update, and this is the information we've been able to find so far about how, essentially, what's going on with these recommendations, whether they've been accomplished, if there's progress being made towards them, or if there aren't any updates that we're aware of. There's a few recommendations, and they're highlighted, I think, for the most part, in some shade of orange or yellow, that we are still working on figuring out more information about. For some of the others, we may think there are no updates, but if you have information otherwise, please let us know. I'm going to go through them line by line. If you want me to kind of linger over any recommendation, just raise your hand or jump in. And yeah, so I hope this is kind of a helpful update for everyone. So they're broken into categories, and so the first category is education. So one of the first recommendations was that loan repayment be broadened to more professional types. And our update is that Act 183 did this successfully for a number of professions. So for physician assistants, medical technicians, child psychiatrists, primary care providers, and nurses. It also created the nurse faculty loan repayment program and some workforce development funding for the DAs and SSAs that included loan repayment funds. So we consider that to be, for the most part, that was accomplished. I'm going to move on to the next one. So just jump in if you want me to go back to that first one. So another recommendation under education was increasing scholarship funding. The funding that was initially created by Act 155 of 2020 and identify a permanent funding source. So this was another area where it was really covered in Act 183, and that is kind of a recurring theme that Act 183 did address a number of these recommendations. And so Act 183 continued the funding for the Vermont Nursing Forgivable Loan Incentive Program, and it created the Nurse Faculty Forgivable Loan Incentive Program and the Mental Health Professional Forgivable Loan Incentive Program. The next one was really regarding the existing scholarship programs. The recommendation was that that someone should evaluate the effectiveness of those existing programs. And the responsible parties working on this is the Department of Health, AHAC, VSAC, and we are not aware at this moment in time of any evaluations that have been done of those different existing scholarship programs. Does anyone have any updates on that we, oh, Jessa, I see your hand.
Sorry, I had one screen here and couldn't unmute myself. Sorry, I had raised my hand actually back up on the line item before. I'm not aware of the evaluation piece, and it actually looks like that says dental school specifically, so I'm not aware of any evaluations in that regard. Under line 4, the scholarships under 155 of 2020, I just think it might be worth noting, since the status update only addresses the Nursing Forgivable Loan Program, that an initial scholarship also created a primary care physician scholarship program. As far as I know, that is receiving permanent funding through the budget process, but it at least has not been expanded. So I don't recall if the expansion piece was applying to both scholarships, but just thought it might be worth at least making sure that people who are seeing this document know that that scholarship includes both programs.
Okay, so just to make sure I understand, so the primary care scholarship program was not expanded, but the funding was continued for it?
Yes, I believe that is an accurate summary of where that scholarship stands. Yes.
Okay.
under line 5, under the evaluation, and I don't actually recall exactly what that evaluation was referring to. If it was talking about the nursing and physician programs as well, I think it's probably a little bit early. Those are just really in their kind of for like year and a half stage. So no students have probably graduated having received those scholarships yet. So that, but I don't know if that's talking about a different scholarship program just for those who attend dental school, in which case I am not aware of that program.
So this one is specifically, I think, about an existing program that was in place.
Yeah, I think it was too, Jessa. And I think it's been in place for a long time. And I think they were just trying during the process. I remember just figuring out, is that meeting some need because it's a small program? Should it be expanded? But we don't know, that kind of stuff.
So in line 6, this is something that is in progress, and this is making the various different financial assistance options for the healthcare workforce just easier to find. Work is being done on that, but it has not been accomplished yet. Revisiting the tax incentive proposals. So there were some tax incentives that were proposed in the governor's state fiscal year 23 budget. Those were rejected by the legislature, so that is the update as far as that's going. There are potential tax incentive work that's being done in other groups. For example, I know some of the people here are on the nurse preceptor call, and so that's an area where potential additional tax incentives are being discussed that would go into future work. There's identifying financial barriers to the recruitment and retention of the non-licensed workforce. This is something that we are hoping to start asking questions about, and some of the surveys will actually be sending out to this group. But as of this moment, we are not aware of any additional work that's being done there. Okay. There's to attract permanent employees. That was part of the Act 183, the recruitment and retention program. And
I'll just note
consider,
that's actually Act 83 instead of 183.
I'm going to turn my camera off. I have to get so close to the screen in order to read it that you guys are going to be, it's gross. But on the non-licensed, I just wanted to make a comment about the non-licensed workforce. So I do think that you are collecting some relevant data, like you're collecting vacancy rates for from anybody who's getting the premium pay program, right? So you actually do have some information about that workforce from that, and the rates, and then the choices for care rate study you're doing now, and that's for direct care workers for long-term care. So I just want to connect those dots for you. Am I frozen?
Thanks, Jill. I think we were consider longer-term grant incentive program. We do not have any updates that I'm aware of there. Increasing enrollment in nursing programs. So Act 183 created the emergency interim grants to Vermont's nursing schools to increase compensation. So that's another area where there were some parts of Act 183 that attempted to address that. I don't know if there is additional information people would like to add.
Can I ask a clarifying question about the status for these updates? Is just like, I went way back to the first one, broaden the loan repayment program. So are we considering that so yes, it's Act 183 created it, but do we consider that a complete activity, or is it in like the one section is, but we don't know where the implementation of it is? I'm just wondering, like in this document, what's the most important to capture?
That's a good question. I think any work that is being done that seems to address it in any way, honestly, should be included. just honestly, in the interest of trying to chase things down, I'm sure that relevant information was missed. So I think it's quite possible that this may not create a finalized version. I will send this out, I think, and people can add additional information to it and then send it back to me, and then maybe we could have a bit more of a complete sort of profile of each recommendation status. Is that helpful? Does that answer your question?
I think so. So it's like trying to capture in terms of status what's going on that we know of right now, but not truly like because that's a whole, a lot of these have once you do the implementation, like this is a very important first step, right? But then it's like, then what's the next things? Because implementing those things are going to take time and probably need to figure out, like, is it working as intended? Is it, that kind of stuff.
Yeah.
Okay, thanks.
No, I mean, it may be helpful so to give this some additional context. So what we're hoping to do is send out a version of this that has more information. And then we're also going to ask all of you to do a very quick survey that kind of is trying to address, okay, so these are the recommendations. This is what has been done. What is a good what is something that has been omitted from these recommendations? And I think it would be probably a good idea for us to make sure that that also includes space to write, like, what are next steps that are kind of critical to keep these recommendations like relevant. And so I think that'll be a space to kind of look beyond the kind of check mark, have they been accomplished, and kind of look forward. Mary Ann?
I have a question about line number 11. Increase enrollment in nursing programs. I know that we had some emergency interim grants for compensation for faculty and staff. I'm just curious if anyone who actually works in one of those places can comment on that, how that's gonna work, or if there's any kind of an update from anyone who's involved. I'm curious because I know we have some union issues and I wasn't sure how those were being addressed. Sherry, did you want to comment on that?
Yes, I have not seen anything come through for the faculty on this end. We did get surveyed by, and it was the chancellor's office about what faculty were getting for salaries. And over the years that they were teaching during COVID, somehow this must be related to the COVID problem, pandemic, but the money has not been given to faculty. That's all I do know. I do know they have not been given any compensation addition to what they have currently been getting or previously been getting. I don't know if that helps or not, but I do know that.
I'm wondering if anyone knows who's working on that.
Are you asking on the state side or on the?
Yeah. I'm asking anybody who knows.
I will just note that some of the implementation challenges we've been dealing with in a number of these grants are that it uses state fiscal recovery funds, which is the tie to COVID that I think Sherry just noted. So my understanding is this comes under the Vermont Department of Health, and they've been working on how this fits within the scope of the allowable uses. So it sounds like perhaps some of that has come up in this surveying and better understanding how the allowable uses tie together. But in some ways I'm speculating there because it's not what I'm directly involved in. I just have been dealing with similar issues on other parts of these grant programs.
Thank you.
Jessa?
Sure, thanks. I just want to comment on the sort of follow-up survey questions that might be coming after this. Personally, I feel like what's most important are some of the next steps already outlined in here that haven't been able to happen yet, as opposed to like adding in new things that are completely missing from the list. So I don't know if that is what you're also sort of thinking of getting feedback on, is sort of what is most important to keep moving forward quickly. Like I'm thinking of, for example, the you know, making it easy to find all the existing resources out there. You know, we've talked about that for quite a while, and I think we've all, you know, we all think that would be really helpful and important. So just a comment on kind of what you're looking for from the group going forward.
Yeah, I would say those are definitely a focus. I mean, we are hoping to increase the number of people within our department who are working on workforce related issues with 2 positions in the spring. And so hopefully some of those will be resolved. I think that this making the sheet is really aimed at trying to identify the progress being made, and then we can work on in future meetings following up on the items here that have not been satisfactorily addressed as well. I think in the survey we're also interested in what if people have, for example, if some, you know, knowing that the money has not yet been distributed from some of these programs is important information, because we're also trying to understand like what actions that have been accomplished or in some state of progress have actually been impactful. So I think it's not just trying to come up with new things to do. It is also trying to assess the current state of affairs. So I definitely understand that. Okay, I think we're on the support transition to practice programs for professional roles. So the governor's 2022 BAA proposal included $1 million to fund transition to practice programs for new hires. That was not accepted by the legislature. So this is the status that we are aware of in terms of this objective. There are any additional bits of knowledge people have? Okay, so the next one is strengthen incentives for preceptors for all professions. So really so the Act 183 created some incentive grants to nurses employed by critical access hospitals for serving as preceptors. The other part of this is that there's also the nurse preceptor working group that is actively trying to identify some incentives that can then be included in an action plan that will be provided to the legislature. So this is, some steps have been taken, and some steps will hopefully be forthcoming. So that's the status of that.
I'll just note on that one, we have a contractor starting today to help on developing all of the necessary materials to roll those grants out. So that's a positive step forward.
Okay, so we're coming to some of the education initiatives or recommendations that we have a little bit less info on. I've reached out to some of the people on the call about this. We're still tracking down pieces of information. So exploring opportunities to expand family practice residency programs. So our understanding is that SVMC is pursuing this. Thank you, Jessa, for that info. And that Bi-State is also pursuing a planning grant for a family medicine teaching health center residency model. So this is the knowledge we've managed to collect on this. Is there anything that anyone would like to add?
Just to clarify, Bi-State was working in collaboration with Lamoille Valley and the community health centers, and the grant has actually just been submitted. I believe it was this past Monday. So whatever the date was on Monday. So the planning grant was submitted, and we expect to hear in the early spring if the award is made. And there are a number of other partners that were part of that as well.
And I'll clean this up before it gets sent out. Thank you. Okay, so these two I don't have any information on. Does anyone know if efforts are being made to modify curriculum to introduce primary care earlier in medical school, or the physician assistant program, if there's been any efforts to establish that? Okay. Oh, Maureen.
Yeah, I can't speak to the Vermont State College's efforts around PA, but I know UVM has been looking at that.
I don't think the Vermont State College system in Vermont Tech, NVU, Castleton has not looked at that. But I think that would be a better place for UVM College of Medicine for the PA program.
Great, thank you. There's another area that is lists the Vermont State Colleges, the modified curriculum to prepare students for work in interdisciplinary teams across the continuum of care. We don't have any updates on that. Are there any updates?
I guess I need more clarification on that. Oh, sorry, go ahead, whoever that is. I can't see.
I can go back to the plan after this meeting and flesh that one out a little bit if that would be helpful.
Yeah, I mean, we do teach our students in the nursing program. We collaborate with paramedicine, respiratory. Not often, we don't collaborate with a lot of the medical teams because they have very different schedules and very different processes as far as around their curriculum. But we do collaborate with many interdisciplinary other professions. So I'm not sure if exactly what that is looking for. So I know we're doing it. I can fill that in later if you send it out.
Great, thank you. The next one is developing and identifying strategies to streamline advancement through the nursing career ladder and upskill existing staff. So once again, this is something where Act 183 created the Healthcare Employer Nursing Pipeline and Apprenticeship Program, which will provide grants to healthcare employers to establish or expand partnerships with Vermont nursing schools to create nursing pipeline or apprenticeship programs. So this one, some work is being done on it. It's in progress, I would say.
The same contractor that I mentioned before, starting today, is working on this as well too. So that should have more information forthcoming soon.
Would you be able to connect me with that person? Because I have a grant from the federal government to do this work as well.
Yes.
That's great. Thank you.
I might just ask something that might help me. I don't know if it would help other people, so if it wouldn't, feel free to ignore this. But when I'm thinking about what progress and I'm reading, like what's there, I guess I'd like to recommend we consider putting a status of in progress and then the information that we have, or complete, and then some of the things have happened, just for context, because that will, in my mind, when I'm looking at this list again, kind of like revisiting the ones that there might be a few that are really easily ticked off here, but then the others are like in progress, and so that just gives us an idea that there's more work to be done in to deepen our dive there, if that's possible.
Yeah, definitely. Marie?
And one thing, Wendy, I was going to ask you more specifically. So it sounds like you hired the contractor. What's the timeline looking like on that?
The goal is to have grants out in April. So this one, the grants in this area are related to now I'm scared I'm gonna get them mixed up, but there's grants for I think this is like tuition assistance grants, and I'll just confirm that and come back. But those are the ones that this contractor will be managing, getting all of the application materials together, accepting the applications, and rolling out those grant awards. And we can get more feedback on those as those are developing. I think the idea is to have her start working through the components of what will be required within the grant application, the parameters of the program. So this would be a great group to be able to come back to with questions as she starts digging into those areas.
Yeah, and I think it just, in addition to the sort of status, if completed or in process and that sort of thing, any special dates that we should be aware of would be helpful, because I know our members are looking for that and could plan for it.
That's exactly what I was going to say, Devin, because I know some might be shorter term deadlines, some might be longer term. And if we're aware of sort of that spectrum, it might be easier to get updates.
Great. We can update you on when the application be out. My goal is to have the grants out in April.
So just out of curiosity, if the grants are out in April, do we have a timeline that they have to be used by too? It seems like anything that's related to ARPA, which this may be, has an end date too.
Yes, the state fiscal recovery funds have an end date, I believe, of 2026. I can look all of this up as we are moving forward and jump back in shortly though.
Great.
This trying to track these recommendations is definitely a work in progress. So the feedback about how to set things up is very useful. So I appreciate that. Okay, so these last two under education, we don't have any updates at this moment. Ensuring that healthcare career education is offered to all students before leaving middle school. I'm not aware of any efforts to have this done. And advertising and recruiting for existing apprenticeship opportunities supported by the Department of Labor. I'm not aware of any new advertising initiatives that are being done.
On the middle school students, you might want to reach out to AHEC. I know it lists AOE here, but I'm not sure that AOE has been particularly involved in this area where AHEC has been. So I know they're a part of this group, but I don't see them here today.
Yeah, I would reiterate that one. They've got a pretty good proposal on
Oh,
this.
great. That's good to know.
I just put the scope and dates in the chat.
I'd like to also mention that the career and technical education centers, a lot of them have programs as well. And that's at the high school level. An example of that is Burlington Tech has a health sciences program that delivers 17 college credits. And it covers the prerequisites for nursing.
Great. It's very good to know. Okay, so we're moving on to recruitment and retention. So inventory and highlight state programs that support recruitment and retention of healthcare professionals. So this one, if we had a little status column, it would say in progress. There's going to be a small group that will be convened to really kind of take inventory of all the state programs in collaboration with AHEC and figure out a way to highlight them.
I'd love by-state to be able to be listed or, part of that. I don't know that we need to be part of the inventory, but on the inventory itself, because we do outreach outside of the state for recruitment of primary care physicians, PAs, nurse practitioners, mental health. So we'd love to be able to be listed as one of those resources.
Will do. Modify or expand programs that support working and living in Vermont. So one example of this that we found was the worker relocation program being expanded to include all types of healthcare professionals. Jessa?
I'd just love to put a plug in on this one. to make sure, I was I thought one of the great goals of having this group under the umbrella of sort of more statewide workforce development items is that we might get ideally notified when there are other statewide worker incentive programs, like, for example, the either the remote or relocation grants. And I don't feel like that's happening yet. I've occasionally looked at the ACDE website, if I have that right, and said like, oh, or I've seen like a press release from the governor. Oh, here's a new like assistance with housing costs or some kind of program that I think, oh, I'd love to be able to tell my members about this. This could really benefit healthcare workers. But I don't feel like I have a great like central place to get notified about that. And so I think, if we could use this group that way or have more of a way that we get notified, that would be really helpful.
Yeah, I think some of our ongoing work, it kind of ties into having like a centrally located repository for some of the initiatives that are available, like the financial incentives, is really finding a way to to clearly communicate, on maybe 1 or 2 sites, the information about these programs. And so that's definitely something that we're working on, and hopefully we'll have some new people joining the team in the next few months who kind of can help coordinate the different activities. Maureen?
Along the same lines as the worker relocation, there's a fund from VSAC that is going to Vermont's state college students and UVM students if they stay in Vermont. And it's a loan forgiveness program that will be kicking off, I think, after the first of the year. I don't have details in front of me, but I can email you a description.
Thank you. That would be great if you could email me. Jill?
Just going back to what Jessa was saying, so a site is helpful, but I definitely am hoping for a push so that we actually see information coming to us actively that we can then push out to our members. It's hard to even articulate how fragmented it feels right now, and how hard it is for us to track this stuff for members and let them know what they need to know about. And we all have newsletters. We have lots of ways we can collate information once we have it, but it's really, really hard to collect. So I wouldn't want to have to remember to go to a site if something new is happening, to be like to check regularly to make sure I didn't miss the new thing.
Yeah,
Yeah,
we
we
hear you. We will work on that. Some of these things, it's, it's hard for us to track down some of the status of these things as well. So it's definitely a work in progress.
Well, that makes me feel better. I have to just say, it's really nice to see a list like this. So I know we have 1,000 comments, but actually this is really nice to see. So thank you for making the attempt and getting it, getting us to a baseline.
I will always take active engagement over awkward silences. So this is great. Okay. So creating a marketing campaign to promote health careers in Vermont. So some information about healthcare careers and additional info for healthcare professionals has been highlighted on Think Vermont. So that's one area that this is happening. Oh, Maureen? Is that an old hand? Okay.
Sorry, it was an old hand. I was trying to get rid of it. Sorry.
No worries.
This is Stephanie, though. I had a question on this one. I think this one is, as I recalled the recommendation, slightly bigger, and I don't know if Bi-State hasn't done any work on this, but as I mentioned earlier, we have that recruitment program, which will be added. But in this case, I think we were talking about both in the state marketing to make sure that, the type of work that AHEC does, where we're educating people about getting engaged in health careers, but also external marketing outside of the state. And I know Think Vermont does connect that way. But so on the New Hampshire side of our work, we're actually doing a large media campaign with a marketing consultant that's been established. And I think we were talking about how do we get visibility for Vermont. What we're doing in New Hampshire is working on that visibility for New Hampshire, but the unique aspects of practicing in healthcare in Vermont, and sort of create a campaign around that and target out folks outside the state, because we just don't have the supply inside Vermont to actually fulfill all the needs, although we have many folks here that we want to make sure that we're retaining. So if that, Bi-State has not done any work in looking for funding for that or anything else, but we'd certainly be happy to participate in any of the conversations that are going on, especially because we're getting some real-time learning from what's going on the other side of the river.
Yeah, that's great to hear. I think this is definitely an area where some initial steps have been taken, but more could be done. I have talked to the Office of Refugee Resettlement about promoting healthcare careers to new Vermonters, and really they're not doing anything specifically in regards to this recommendation. Their goal is really matching new Vermonters with careers that, you know, fit their skills and interests. So it's not that healthcare careers are not being offered, it's that there is not a strategy to focus on healthcare careers. This may be something where maybe the recommendation needs to be altered slightly to make it more specific, or, you know, some work may be needed to be done to alter that kind of recommendation to suit the office better. Developing a cross-system strategy to utilize Section 9817 of the American Rescue Plan Act. So this is, this is basically some of the work that Wendy has been doing.
I'll just note that $25 million of that plan was allocated for the workforce recruitment and retention program. So in the sense of it being a cross-system strategy, this funding is available for a broad swath of multiple employer types. So we're working on setting up round 2 now. Round 1 employers have till either, if they took a 90-day disbursement, some may have dispersed all their funds, but others have funding available through the end of June 2022.
Then moving on to the supporting organizational wellness and peer support programs for healthcare professionals. So I'm currently talking to the Director of Trauma Prevention Resilience Development and trying to track down what work is being done here. If there's anyone on the employer side who has any info, you know, any updates on this that anyone would like to share now, or you can always add it later. Okay, moving on to the reduced administrative burden, which is a pretty broad recommendation. One thing that is being done is Act 167 in 2022 did include several points that were aimed at reducing the administrative burden, specifically regarding prior authorizations. So if there were a column with status, I'd say that it's in progress, that some steps are being taken. There's always more that can be done. If there are specific administrative areas that could be, that work could be done on, then that could definitely be an area that you could add to this once we send this out. Seeing no comments. So this category was called practice changes in the report. Some of these are regarding reimbursement. So this is maximizing Medicare and flexibility and reimbursement through Vermont's All-Payer ACO agreement. So there have been steps that Vermont has taken to propose that Medicare recognize and reimburse licensed mental health and substance use disorder treatment professionals, in the hopes that this would expand the number of providers who can treat and bill for Medicare patients. There's also new Medicare billing rules that allow for licensed professionals to bill Medicare under general physician supervision instead of direct physician supervision. There's more work that will be done in this area. So I would say that one was in progress. So the next three are really mainly things that are being done through DFR and DEVA regarding telehealth. And so the first one is developing a commercial reimbursement model for audio only services. So this was made required. And so there's work being done to roll this into a capitated payment model. So DFR is working actively on this.
Can I just
telehealth-
add that I would still, this is Jessa, I would still definitely list that one as in progress, in that the fee for service rates are not at parity, which remains a big issue for provider organizations. So
And do
I
we
would
still
just-
have, Jessa, is the current structure for telehealth reimbursement in Vermont still set to sunset in 2025?
For telemedicine, the parity requirement is set to sunset. I believe it's 2026.
Okay.
And then but the audio only reimbursement model goes through, yeah, I think you're right. That one I think is, actually, that's just 2024, I believe, if I have my dates right. I'd have to look it up. And I'm not aware that there's work going on in terms of the capitated model yet.
Okay. I look forward to that work going forward.
Yeah.
Okay, so that one is definitely in progress and not completed. As far as there's work being done, from what we understand at DFR and DEVA, to both make telehealth billing requirements clear and to expand them. So the expanding telehealth coverage was done in, I think it was last year. So I think these are ongoing areas. I think people are really, with the pandemic, exploring how to use telehealth for different services. And so this is an area going forward that there will probably be a lot of work going on. The statewide telepsychiatry program, so VPQHC received some funding from the congressionally directed spending grant to do this. And so they're currently working on this. They have received, I think they've received the money, so this is in progress. Still tracking down a little bit more information about that.
You could also actually list VPQHC under the telehealth billing requirements. I believe they are also trying to create sort of a chart or a way to help practices keep track of all of those different billing policies for different payer types. With credit for Helen for starting that during the pandemic. It just hasn't been updated in about 2 years.
I was going to say, and Medicare would have to make some significant changes to their system to actually make it clear, but.
Okay, so the last few are really major regulatory changes, very few of which I would say are, none of which I would say honestly are completed, I believe. There is advertisement being done to promote the fast track for healthcare professional licensure for all OPR regulated professions. I think that may be an area where maybe more advertisement is needed. Canadian healthcare workers regarding line 37 are already differentiated slightly, but no work that I'm aware of, or that I could find out information about, has changed since this report was written, which was like November 2021. So if there has been new work on that, that would be great to be aware of. Reducing licensing barriers for telehealth practice. I think that this is in progress, but we would love more detailed information about this. And then there's evaluate further opportunities to remove barriers to licensure for mental health. We don't have as much information about what work is being done by OPR about that. So that's an area we're still working on. And then considering temporarily waiving licensure fees for first-time licensed nursing assistants. So our understanding is that this was looked at, but there would need to be a new funding stream to replace those fees. And so it kind of has come to a standstill, kind of stuck on what that new funding stream would be. So I'm going to stop there and Maureen?
I put in the chat the act that forgives loans for students that stay in the state after graduation, but I think that act also included funding to VSAC to support any licensing fees if people were testing. Say they were taking an industry recognized credential like LNA and they needed to pay for a test or an exam after, and I think that covers that cost. So it's a VSAC funded program that students would have to apply for.
Thank you. That's great to know.
Oh, I saw in the chat, I think it was just the testing fees, but I could be wrong. I think they might have included books and other requirements to get that licensure. So I would have to check with VSAC to clarify.
Okay. Yeah, if you hear anything, just either when I send this out or you can always shoot me a separate email about it. We have 6 minutes left, so I'm gonna stop sharing for a sec. And so I'm gonna clean this up, try to add the modifications that were requested, send it out to everyone. If you have, I wish there was a way that we could create a document that was shared that we could all kind of edit simultaneously, but we can't figure out a way to do that with the current state tech setup. So just send it to me and I will compile as best as I can and then send it out again for further review. I think there were just a few other items that we wanted to talk about today. We had the second nurse preceptor working group meeting this afternoon, which I think several of the people here were on. We're exploring some different ways that we can maybe have tax incentives that may help and incentivize people to participate as nurse preceptors, and looking at what other states are doing and how Vermont could potentially build on some of that work and, fill some of the needs that are met. We're also looking at different models for improving the number of clinical opportunities. And so there's a couple of different angles that are being explored. And so we have a draft action plan due to the legislature. So that will probably be reviewed in one of the next meetings of this group, I would imagine. Another quick update. So we sent out the primary care survey. I believe we discussed it in the last meeting to 135 of the Blueprint primary care patient-centered medical homes. It's closing at the end of business today. Last I checked, we had exactly 100 practices that had submitted surveys, so it's like pretty impressive response rate. We will be producing a report, like a preliminary report will hopefully go out in January that tries to quantify some of what we're seeing in that survey, particularly with respect to wait times, provider turnover, things like that. And then we will be following up with practices throughout the spring to try and understand some of the issues that they raised regarding workforce and different issues that they said were basically being significant barriers to their ability to provide care. So there will be substantial follow-up on that survey. I don't know if Betsy is still on, but are there any updates on the student licensure that you would like to share? Sorry, I feel like I'm always putting you on the spot, Betsy.
No, that's okay. Yeah, so we have comments out for the administrative rules that would need to be changed. And then we'll sort of address what statutory changes may need to happen with the Nurse Practice Act. But I think it's pretty widely supported and would it involve, you know, some flexibility with how we create nurses. So.
Great, thank you. Are there any other items that anyone would like to address in the last 2 minutes? Well, thank you all for hanging on this long and squinting at all the recommendations on your screen. And we'll try to clean it up and get it out to you in the next few days. So I hope everyone stays safe in the snowstorm. And yeah, I'll give you 1.5 minutes back or so.
Thank you.
Thank you.
Thanks, Laura.
Bye-bye.
Take care.
Thanks, Laura.
Happy holidays.
Bye, everyone.